Welcome to today's video about what causes hiccups. Have you ever wondered what causes your sudden, pesky hiccups? Why do they seem to appear out of nowhere? And how can you stop them? In today's video, you'll uncover the science behind hiccups, explore common triggers, and learn some effective remedies. Ready to get started? Hit the subscribe button below and stay tuned to discover more about this fascinating phenomenon and how you can avoid those unexpected hiccups. Hiccups are repetitive, uncontrollable contractions of the diaphragm, the muscle structure just below your lungs. The diaphragm marks the boundary between your chest and abdomen, and it also regulates breathing. When your diaphragm contracts, your lungs take in oxygen. When your diaphragm relaxes, your lungs release carbon dioxide. The diaphragm contracting out of rhythm is what causes hiccups. Each spasm of the diaphragm makes the larynx or voice box and vocal cords close suddenly. This results in a sudden rush of air into the lungs. As a result, your body reacts with a gasp, creating the sound characteristic of hiccups. There's no way to anticipate hiccups. With each spasm, there's usually a slight tightening of the chest or throat prior to you making the distinctive hiccup sound. Most cases of hiccups start and end abruptly, for no noticeable reason, with episodes generally lasting only a few minutes. There are many factors that can contribute to hiccups, including 1. Eating or drinking too quickly. When we eat or drink too quickly, we tend to swallow air along with our food or beverages. This excess air can irritate the diaphragm, causing it to spasm and resulting in those pesky hiccups. Additionally, eating too quickly can also lead to overeating, which puts additional pressure on the stomach and can contribute to hiccups. To prevent getting hiccups from eating or drinking too quickly, try taking smaller bites and sips, chewing your food thoroughly, and slowing down your pace. This will help reduce the amount of air you swallow and decrease the likelihood of experiencing hiccups. 2. Carbonated beverages. When we drink carbonated drinks, such as soda or sparkling water, we are consuming carbon dioxide gas along with the liquid. This gas can cause our stomach to become distended, leading to pressure on the diaphragm. When the diaphragm becomes irritated or compressed, it can spasm involuntarily, resulting in hiccups. Additionally, the bubbles in carbonated drinks can also irritate the nerves in your esophagus and stomach lining, which can trigger hiccup reflexes. If you find yourself dealing with frequent hiccups after consuming carbonated drinks, you may want to consider reducing your intake or opting for non-carbonated alternatives. 3. Eating spicy foods. Have you ever found yourself enjoying a spicy meal, only to be suddenly interrupted by a bout of hiccups? When we consume spicy foods, such as those containing chili peppers or hot sauces, our bodies react by increasing blood flow and releasing endorphins. This surge in activity can sometimes lead to irritation of the diaphragm, and when this irritation occurs, the diaphragm can spasm involuntarily, resulting in the familiar sound and sensation of hiccups. Additionally, spicy foods can also stimulate acid production in the stomach, which may exacerbate existing conditions like acid reflux or heartburn. This increased acidity can further irritate the nerves that control the diaphragm's movement, potentially triggering hiccups. To help alleviate this issue, try drinking water or consuming something soothing like milk to help neutralize any excess spice in your system. Taking slow, deep breaths and focusing on relaxing your diaphragm muscles may also help reduce hiccuping episodes. 4. Emotional stress or excitement. Strong emotions such as anxiety, stress, excitement, or fear can activate the autonomic nervous system, which controls involuntary bodily functions. This activation can send erratic signals to the diaphragm, causing it to contract involuntarily and produce hiccups. If you experience hiccups due to emotional stress or excitement, try taking slow, deep breaths or sipping on water to help calm your diaphragm and potentially alleviate your symptoms. Also, managing your stress levels through relaxation techniques or mindfulness practices may also help prevent future episodes brought on by emotional triggers. 5. Sudden changes in temperature. When we are exposed to extreme temperatures, our bodies go into overdrive trying to regulate our internal temperature. This can lead to spasms in the diaphragm. These spasms in the diaphragm can result in hiccups as they cause the vocal cords to close suddenly, creating that characteristic hic sound. Additionally, changes in temperature can also affect nerve signals and blood flow throughout the body, further contributing to hiccup episodes. So next time you find yourself with a case of hiccups after stepping out on a hot summer day or coming in from a cold winter night, just remember that it's likely due to your body adjusting to the sudden change in temperature. And don't worry, they usually go away on their own after a short while. 6. Alcohol. When you drink alcohol, it can irritate the nerves in your stomach and esophagus. This irritation can lead to spasms in the diaphragm, which is the muscle responsible for controlling your breathing. When the diaphragm spasms, it causes you to take in air quickly, resulting in the characteristic hic sound. Additionally, alcohol can also relax the muscles in your throat and esophagus, making it easier for air to enter your digestive system and trigger hiccups. It's important to note that not everyone will experience hiccups after drinking alcohol, as individual reactions can vary. However, if you do find yourself plagued by hiccups after a night of drinking, there are some remedies you can try to help alleviate them. These include holding your breath for as long as possible or sipping on cold water slowly. 7. Chewing gum. Chewing gum is a popular habit for many people, whether it's to freshen their breath or simply pass the time. However, did you know that chewing gum can also be a trigger for hiccups? When we chew gum, we are constantly swallowing air along with the saliva produced in our mouths. This excess air and saliva can lead to an accumulation of gas in our stomachs, which can then irritate the diaphragm, the muscle responsible for controlling our breathing. When the diaphragm becomes irritated, it can spasm involuntarily, causing us to take in a quick breath, followed by a sudden closure of the vocal cords, resulting in a hiccup. Additionally, chewing gum can also cause us to swallow more frequently than normal, which further increases the likelihood of swallowing air and developing hiccups. If you find yourself experiencing hiccups after chewing gum, try taking a break from this habit and see if your symptoms improve. It's always best to listen to your body and make adjustments as needed to avoid any discomfort. Lastly, at number 8, we have medical conditions. While most cases of hiccups resolve on their own within a few minutes, persistent or severe hiccups may be a sign of underlying conditions. Medical conditions that can cause hiccups include 1. Gastroesophageal reflux disease (GERD). GERD is a digestive disorder that causes stomach acid to flow back into the esophagus, leading to symptoms like heartburn and regurgitation. Hiccups can also occur as a result of irritation to the diaphragm caused by acid reflux. 2. Nerve damage. Damage or irritation to the phrenic nerve, which controls the movement of the diaphragm, can lead to persistent hiccups. This nerve damage can be caused by conditions such as multiple sclerosis, stroke, or tumors. 3. Central nervous system disorders. Certain neurological disorders, such as meningitis, encephalitis, or brain tumors, can disrupt the normal functioning of the central nervous system and trigger hiccups. 4. Respiratory issues. Conditions affecting the respiratory system, such as pneumonia or asthma, can cause irritation to the diaphragm and lead to bouts of hiccups. 5. Medications. Some medications may have side effects that include causing hiccups as a reaction. These could include drugs used for treating anxiety, epilepsy, or chemotherapy. If you experience frequent or prolonged episodes of hiccups, along with other concerning symptoms like chest pain or difficulty breathing, it's important to consult with your healthcare provider for further evaluation. In conclusion, while hiccup episodes are often benign and temporary nuisances, understanding what triggers them can help minimize their occurrence and provide relief when they do happen. Remember to stay hydrated, eat slowly and mindfully, manage stress levels effectively, because prevention is always better than cure. If you enjoyed this video and want to learn more about your health, be sure to hit the subscribe button below. Give this video a thumbs up and share it with your friends and family. Thanks for watching. Until next time, stay healthy and stay well.